This video is brought to you by the Wyoming State Board of Nursing. It's on our Chapter 2 updates and review. Effective December 17th of 2025, Chapter 2 had some updates. This slide represents the changes in Section 3, Licensure Certification by Exam. A change to the RN and LPNs is that an applicant may take the NCLEX a maximum of 5 times within 5 years from the date of graduation. An applicant who has not passed the NCLEX within the 5 attempts and prior to the 5 years from the date of graduation must complete a board-approved NCLEX prep course. And an applicant who has not passed the NCLEX within 5 years from the date of graduation must complete a board-approved nurse refresher course to take or retake the NCLEX. A list of board-approved NCLEX prep courses and board-approved nurse refresher courses are on our website. For our CNA applicants, an applicant may sit for the NATCEP or similar national exam no more than 5 times within the 2 years period following completion of their course. For other certifications, the Medication Aid Certified, or MAC, is an applicant. They can sit for the MAC examination no more than 5 times within the 2-year period following their course completion. Section 11 addresses the expiration dates of applications. Applications awaiting documentation shall be active for 12 months. If the board office does not receive an applicant's completed application within those 12 months, the application shall expire. If the application has expired, the individual seeking licensure or certification shall submit a new application along with the appropriate fees and all required documentation. One of the biggest changes made to Chapter 2 is Section 14, Competency for Licensure or Certification, continuing in or returning to practice. We're going to break this up into several slides. The first slide here is for Advanced Practice Registered Nurses, or APRN. For an APRN competency, you're going to need to have current national certification as an APRN in a recognized role and population foci area, or if you were recognized as an APRN in the state prior to January 1st, 1999, and you've maintained continuous licensure, but you're not nationally certified, then the APRN shall submit evidence of 40 hours of continuing education related to the APRN's recognized role and population foci, and 400 hours of active nursing practice as an APRN during the last 2 years. Additionally, an APRN shall submit evidence of 3 continuing hours of education related to the responsible prescribing of controlled substances or treatment of substance abuse disorder. So if you have a current national certification as an APRN, you will need to submit and make sure that your national certification is accurate and updated with the board, and you will also need to submit 3 hours of continuing education related to that responsible prescribing of controlled substances or treatment of substance abuse. If you were licensed before January 1st, 1999, and you have that continuous licensure, but you're not nationally certified, then you would need to submit the 40 hours of continuing education in your population and foci area and 400 hours of active nursing practice, and the 3 hours of continuing education related to the responsible prescribing of controlled substances or treatment of substance use disorder. So all APRNs in the state, upon renewal, need to submit 3 hours of continuing education related to responsible prescribing of controlled substances or treatment of substance abuse disorder. Advanced practice registered nurses need to maintain their national certification for licensure. Upon the renewal of that national certification, the advanced practice registered nurse needs to reach out to the credentialing body and have them send the updated national certification to us at wsbn.licensing@wyo.gov. We do require primary source verification, meaning that the verification has to come from the credentialing body. You cannot upload your national cert yourself into the nurse portal. Next, under Section 14, competency for licensure, certification continuing in, or returning to practice, relates to our RNs, LPNs, or VNs. An RN or LPN shall demonstrate continuing competency by completing one of the following in the past 2 years: 400 hours of active nursing practice, or successfully pass the NCLEX, or complete a refresher course or the equivalent accepted by the board, or complete a nursing education program that confers a degree beyond the applicant's basic nursing education, or submit evidence of 40 hours of continuing education. There are lots of options here in order to meet the competency requirement for renewal. Continuing with competency for licensure, certification continuing in or returning to practice, Section 14 for CNAs. A CNA shall demonstrate continuing competency by completing one of the following in the past 2 years: 400 hours of employment in the CNA role, or 40 hours of continuing education, or has successfully passed the NASF or similar national exam. You need to complete one of those in the last 2 years. I'd like to review the Chapter 2 definition of active nursing practice. This is not new and it has not changed, but the active nursing practice means engagement in paid, unpaid, or voluntary activity in which the nurse applies knowledge or clinical judgment in a way that influences patients, nurses, organizations, or systems. Active nursing practice may include volunteering in health or nursing professional organizations. We often get the statement or question that nurses don't have active nursing practice because they aren't at the bedside. And that may not be true. A lot of nursing roles, such as charting systems, IT, data collection, case management, and non-traditional health systems, can fall within this definition. We'd like you to look at your job description, and if the role itself requires the license, then that meets our definition of active nursing practice. A lot of volunteer work for nursing professional organizations, they have an impact on patients, nurses, and healthcare systems. That would meet our active nursing practice. Therefore, you may be able to meet the active nursing practice of 400 hours a lot quicker than you think. I'd like to review continuing education. If you're interested in meeting competency by turning in 40 CEUs, let's review the definition of continuing education per Chapter 2. It refers to the learning experiences obtained after initial licensure or certification and designed to augment the knowledge and skills of nurses and CNAs and enrich their contributions to quality healthcare and the pursuit of nursing career goals. We do have a continuing education advisory opinion on our website. But if you have a question on whether something would be accepted or not, you can always send that information to the wsbn.practice@wyo.gov email, and we'll review that. Make sure you list your current level of license, the course or activity description or syllabus, who provided the education, the number of hours, and if you have a certificate of completion or a transcript. The continuing education has to be within your scope of practice. Please take a look at the continuing education advisory opinion located on our website. In Section 16, Quality Assurance and Documentation of Audit. This update to Chapter 2 reflects that the board may conduct audits to verify competencies as outlined in Section 14. And upon request of the board, licensees or certificate holders shall submit documentation of compliance. 2026 is a renewal year. Per Chapter 2, all licenses expire on even years on December 31st. This year, December 31st of 2026, all licenses will expire. Our renewal period starts October 1st of 2026. You want to make sure that you verify and update your address before that renewal time. There's instructions here on the screen on how to do that. You can locate your nurse portal account by going to our website at wsbn.wyo.gov. On our homepage, the nurse portal is this quick tab right there at the bottom. Select that, make sure all your information is correct, and starting October 1st, you can start that renewal application. Our Nurse Practice Act and all of our administrative rules and regulations can be found on our website at wsbn.wyo.gov. If you scroll down to the bottom, you'll see the Nurse Practice Act and all of our chapters. Chapter 2 discusses the licensing and certification requirement. Again, this was just updated December 17th of 2025. Also on our practice page, you'll be able to see some practice resources and advisory opinions like the ones mentioned in this presentation. If you have any questions about administrative rules, advisory opinions, please reach out to us. If you have licensing questions, please email our licensing department or give us a call. Thank you for watching our presentation, and we look forward to our renewal season.